Hello and welcome to our video about halitosis and how to cure it. Knowing what is halitosis will help you find a cure. Different treatments work for different causes. If you suspect that your breath is causing halitosis, it's time to see a dentist. Your dentist will check your teeth and mouth for trapped food and infections. He or she can recommend various dental treatments, including professional cleaning of your teeth. Listed below are some treatments for halitosis. Chronic bad breath. If you're suffering from chronic bad breath due to halitosis, you're probably wondering how to treat it. While there are several methods, halitosis is a medical condition, and halitosis home remedies can only help you treat the symptoms. Visiting a dentist for a professional evaluation is essential to curing halitosis. Halitosis can be caused by many different dental problems. Cavities cause bad breath because food gets stuck in them. Mouth sores and dental abscesses are also common causes of halitosis. In addition to cavities, gum disease and thrush are common causes of chronic bad breath in children. If these issues are present, you'll want to consult a dentist to ensure there aren't any other underlying health problems. A dentist can diagnose chronic halitosis by examining your mouth and your symptoms. If you think a problem is a dental infection, your dentist may prescribe an antimicrobial mouth rinse or recommend professional cleaning to help you get a fresh breath. If your dentist diagnoses no underlying medical conditions, your dentist can prescribe a dental treatment. But if your symptoms persist for more than a few weeks, it's time to visit a dentist. In the meantime, your doctor may want to check if there is an underlying health problem that's causing your halitosis. In many cases, halitosis is a result of an infection in the throat or sinuses. If this condition is chronic, it may be best to seek treatment as soon as possible to avoid the embarrassment it can cause. Lifestyle changes. In addition to your daily routine, your diet may also be a contributing factor to bad breath. Certain foods contain sulfur compounds that can remain in the mouth for a long time. These compounds are then expelled with your breath. A healthier diet and a regular dental checkup can help alleviate the symptoms of halitosis. Here are some tips for improving your breath. Eat yogurt with probiotics. Probiotics are good bacteria that can combat the harmful bacteria that cause bad breath. A recent study showed that consuming 3 ounces of sugar-free yogurt twice a day reduced the amount of bacteria in the mouth. Furthermore, yogurt contains polyphenols, which are natural chemicals that have been shown to reduce bad breath. Parsley is rich in chlorophyll, which makes it a delicious alternative to garlic. If your halitosis is chronic, a dentist may recommend that you seek medical attention. While halitosis is not a serious issue, it may be a warning sign of a serious health problem. If you have cavities or deep pockets caused by gum disease, they may harbor bad breath bacteria and contribute to halitosis. Therefore, it is important to get checked out by your dentist to rule out any underlying health issues. Diet is another potential cause of halitosis. A very low-calorie diet and high-protein eating plans promote the breakdown of body fat. While these plans are beneficial for losing weight, they can also cause a fruity smell on the breath. You should consult a doctor before making any lifestyle changes, because some of these diets can cause halitosis. So, if you want to have fresh breath and a good smile, consider making some changes in your diet. Tobacco products. In addition to causing bad breath, tobacco products also increase the risk of developing some serious illnesses. For example, chronic dry mouth, caused by smoking and chewing tobacco, can lead to bad breath. Tobacco products can also contribute to the development of gum disease, which in turn can cause bad breath. Tobacco users are also more likely to develop diabetes and liver or kidney problems. Tobacco products can also contribute to halitosis. Smoking tobacco is the leading cause of halitosis. The odor from cigarette smoke lingers for hours after a smoker has finished a cigarette. The smoke inhalation leaves behind residue that forms a chemical film in the mouth and throat, which feeds the anaerobic bacteria that cause bad breath. Regularly using an oral care probiotic product can reverse this dry mouth trend. Regardless of how bad your breath may be, avoiding tobacco products is still the best way to ensure that your odor stays fresh. Smoking contributes to the development of periodontal diseases and is a major cause of halitosis. A study by Rad et al. examined the effect of smoking on salivary flow in 100 smokers. The results revealed that smokers' salivary flow rate was 0.38 milliliters per minute. Compared to non-smokers, smokers showed a significantly higher incidence of halitosis than non-smokers. Infections. Treatment for infections of halitosis can include using a special mouthwash, a saline nasal spray, and oral care products such as toothpaste. Infections in the perioral region are also a possible cause of bad breath. Infections of the mouth may also include trimethylamminuria, a metabolic disorder that affects the body's metabolism. Treatment for halitosis should be geared toward addressing the underlying cause of the condition. Oftentimes, treatment involves proper oral hygiene and cleaning of the tongue with a special scraping device. Infections of the mouth can also result from other diseases such as periodontitis and gingivitis, which cause increased inflammation of the gums and form pockets that can hide bad breath organisms. Cold sores and fever blisters are other. Infections of halitosis can cause oral malodor and are commonly associated with respiratory infections. Symptoms of oral malodor typically arise during the morning, especially for those who experience nasal obstruction, sleep in a dry, hot environment, or suffer from an upper respiratory tract infection. Some people can experience this malodor for several hours before the smell subsides. Other causes include tobacco and alcohol consumption. Betel nut products can produce a persistent odor in the mouth. A sniff test of the exhaled air is the first step in diagnosing halitosis. While oral infections produce a more pungent odor, systemic conditions tend to produce a less distinctive but still unpleasant odor. To avoid a negative result, the patient should abstain from eating or drinking for at least 2 hours before the test. The patient will then exhale in front of a 10 cm distance from the examiner's nose. Medications. The underlying cause of halitosis is often a dental condition, such as gum disease or dental caries. In some cases, a combination of these causes can lead to the condition. Treatment for halitosis depends on the underlying cause. If you have a sinus infection, antibiotics may be necessary to treat the underlying condition. In other cases, halitosis may be a symptom of a more serious medical condition, such as diabetes or liver or kidney disease. Medications for halitosis aren't a cure for halitosis. The only effective way to eliminate halitosis is to treat the underlying cause. Using breath mints doesn't help, and these treatments just cover up the problem. To treat halitosis, you should see your healthcare provider, use a non-alcoholic mouthwash, and brush your teeth twice a day. Also, drink plenty of water to keep your mouth from drying out. Identifying the cause of halitosis is the first step toward treating the condition. A variety of foods can contribute to the odor of your breath. In many cases, halitosis is a symptom of a more serious condition. Some medications may make your breath smell more strongly than others. It is important to determine which medications are the best treatment for your situation. If you know the cause, you can start treatment as soon as possible. Pseudo-halitosis. You've heard of halitosis, but what exactly is it? While the term bad breath may sound alarming, it actually refers to a variety of conditions, including gum disease, dry mouth, and poor oral hygiene. The best way to determine the cause of your bad breath is to visit a dentist. A dentist can rule out periodontal disease and identify any other problems with your mouth that may be causing you to smell bad. While the term pseudo-halitophobia is often used to describe a severe type of pseudo-halitosis, it is misleading when considered in conjunction with other medical terms, such as pseudo-Cushing's syndrome, intestinal pseudo-obstruction, and pseudolymphoma. Moreover, these medical terms often refer to non-existent odors and physical entities, whereas halitophobia is a psychological disorder. Pseudo-halitosis occurs when the patient cannot detect the odor on his breath after treatment. Pseudo-halitosis accounts for about 15% of all cases and requires a referral to a medical professional. Pseudo-halitosis is more common than real halitosis, so it is important to seek medical advice if you suspect you may have it. An organoleptic examination is an effective way to determine whether a person is suffering from halitosis. It includes an assessment that allows the examiner to smell exhaust air and classify it according to a scale of 0 to 5. Till next time, have a great day.